When I was diagnosed in 2008, that was 10 years ago, I was very lucky to be able to get the help from a compassionate neurologist at University of British Columbia. And after several months of MRI, lumbar puncture test, and other things required to make sure that I have the right diagnosis, he told me that I did have this vascular dementia and possibly Alzheimer's. So that was quite devastating because as most of us who are familiar with dementia, the illness itself is quite devastating for the patient himself and for the family. With the help of the gerontologist and the social worker, I went through a lot of research and found out on how to prevent the deterioration of the illness. Basically, what it's telling me is a change in lifestyle, change in the way I eat, and social networking. I found that the social networking is the most important part of all because it allows my brain to work a little harder and work into different areas that are quite exciting. And since then, I volunteered into several organizations, being part of the advisory committee or advocacy groups to create awareness about a disability. The hospitals themselves are doing a great job, but there are little tweaks that can be done to help improve the services to the public. Well, my sister is still going through the system, and they're good providers, but I think the systems are overwhelmed with patients, and sometimes you wait 3 hours in the morning. They tell you you have to be there at 9:30 and they don't see you until 1:30, kind of thing. People with lived experience are your best resource for ideas on how to improve service, because sometimes we are focused in delivering a service to solve the physical ailment, but we do not look at what the experience of the patients had been going through the system. So it is quite important to see the reaction or how the patient felt after the service was delivered. And from this experience, I think the hospital or the health provider should be able to get some sort of little ideas to tweak the system to make sure that they're doing a proper job of delivering the needs of the patient, not only physically, but also the emotional side of the patient.